Ashley Kjos. I am the director of Woodland Centers. I am a licensed psychologist by training, and so I do approach this from kind of that clinical standpoint, but also from an administrative standpoint, being the director of a mental health center. So I can empathize with both sides of the coin of understanding the mental health concerns that people are experiencing, but also how do you manage this, excuse me, as a director or somebody who's managing a business. So I'm trying to approach it from both sides of that. So if you have any questions, like Kim said, please don't hesitate to put them in the chat, and we'll try to get to them as we're able to. So I wanted to start with just a little bit of information about Woodland Centers. So we are a community mental health center. Our mission is to support people of all ages in finding recovery and hope. And so we do that through a few of our core values, which are willingness, leadership, and knowledge. And we have our staff really embody all of those core values in the work that we do with our clients. Our why statement, why we do what we do, is really about connections. We find that if we're able to help our clients connect with us, connect with community resources, if we as an agency can connect with our partners, we're able to transform the lives of our clients and our communities. And so all of that is part of what we do at Woodland Centers. If you're not familiar with us, we have been around for over 60 years. We serve 7 counties, so being Meeker, Renville, Lacaparo, Swift, Big Stone, they're all listed there. We are a private nonprofit entity. I think people don't recognize that we are a nonprofit, but that is an important part of who we are. We serve a lot of individuals. So last year in 2020, we served over 5,500 people, and it's the entire age range. So we had folks that were about 1 year old or a little bit under, mostly serving parents at that point, all the way to people in their 90s and facing end of life issues. So we offer services to help people at all stages and ages, and we offer intensive services or sometimes less intensive services. We have approximately 185 staff across our 7 counties, and again, just offer a really wide range of services that we offer to everybody. So a little bit about us. So I wanted to start off today just having some groundwork about when we think about mental illness, what is that? And what is this concept that we're talking about? And I think the easiest way to consider this is when somebody starts to experience mental health concerns, they typically have a change in the way they're thinking, the way they're feeling, the way they're behaving, sometimes all three. And then those changes then tend to affect their environment and how they interact with their environment. So if you think about somebody who starts to experience depression, often their thoughts become really negative. They start to think negatively about themselves, about their life. Then they start to feel more depressed. And their depression then leads them to not engage with people. Maybe they're not coming to work as they're showing up late for work, and their behavior starts to change. When their behavior starts to change, they stop doing the things they enjoy. Their thoughts get more negative. Their feelings get worse. And it's just this downward spiral that can happen until you intervene. And so that's really kind of the shortcut to thinking about what mental illness is. I think it's really important that everybody here understands that mental health conditions are health conditions. When we think of things like diabetes, cancer, mental health conditions such as depression and anxiety are health conditions. They're in the same manual, they're in the same book. They are a part of our health and wellness. And so we have to treat them as such. The other thing to think about when you think about mental illness is that it affects everybody. It does not discriminate on age, race, gender, socioeconomic status. It does not matter any of those pieces. It affects everyone. And so it's important for all of us to be mentally well and to consider all the pieces that might go into us having mental health. And the causes for mental illness are also pretty diverse. So it's not just one thing that creates people struggling with mental illness. So we think about biology. If you have a family member who has experienced mental illness, such as depression, anxiety, schizophrenia, those things are sometimes genetically based. But it's also environmental. If you grow up in an environment where you are living in poverty, you cannot get food every day, maybe there's some physical or emotional abuse occurring, those things can also contribute to the development of mental illness. So it's a whole range of things that can come together to create mental health conditions. So when we think about mental illness, it's also important to think about how many people are struggling with this. So on average, 1 out of 5 people deal with a mental illness in their lifetime. Recent research from June of 2020 showed that about 40% of Americans were struggling with mental illness. So what that tells me is that because of COVID, twice as many people were struggling. That's a huge jump from our normal average. And I think we're seeing that. If you have staff, if you have children, if you have friends or family, you're seeing it. You're seeing people struggle. And the results of COVID have really contributed to that. The isolation, the frequent changes, the uncertainty of really what's happening really compounds the issue. Other stats that I think are important to understand, oftentimes 90% of people who seek treatment for mental health recover, they get better. However, like 66% of people never get treatment. They never go in, they never get the help they need. And when people do go get treatment, often they're waiting 8 to 10 years before they ever seek help. So by the time somebody does come to get treatment, they're often in a really, really severe state. They're in a crisis state. And so then it takes longer to get somebody back to their baseline, if at all, if they're able to. And putting that into perspective, if somebody had diabetes, if somebody had cancer, and they told you they were going to wait maybe 8 years to go get treatment, you would tell them they would die. That's just not okay. And so for us in the mental health world, providing services and trying to help people get better, that's part of the curve we're trying to make better, is that people need to seek services sooner. They need to really come in when they're starting to experience something so that we can help them recover faster. So that's what I'm hoping you'll get out of some of this today. But as I said, most people are going without treatment. And a big reason for that is stigma. People fear mental health concerns. People fear talking about it. People feel like they're going to be judged, they're going to be ridiculed, that others are going to devalue them. When we think about mental health, we often blame people for their mental health condition. We say things to them like, well, if you just tried harder, you'd probably feel better. If you just, worked a little bit more, you probably wouldn't be so depressed. And that it feels like blame to people who have a mental health condition, because I can tell you that if it was that simple, they'd do it. They would have already done it. They've probably already tried it, but it's not working. And so it's one of those things that we need to be better about, of allowing people to express when they're struggling with something and being willing to listen. I think, just again, to put this into perspective, have you ever sent balloons or a card to somebody for a physical health problem? Somebody might have been in the hospital, and what do? You send them flowers. Have you ever done that for somebody struggling with mental health? Have you ever seen a GoFundMe page for somebody struggling with anxiety or depression? Probably not, but you see it all the time for when somebody's struggling with a physical health concern. So there's a disparity there, there's a difference, and people feel it. So this is the other piece to think about. What are your perceptions with mental illness? What do you think of when you think of the term mental illness? I would say a lot of people who are not familiar think of this. They think of people who are scary. They think of people who are homeless. They think of people who are maybe in a facility, locked up somewhere. But in reality, this is what mental illness looks like. It's our celebrities, it's our presidents, it's our doctors, it's our lawyers, it's our veterans, it's our neighbors, it's everybody. It's touching you, it's affecting you in some way, whether you know it or not. So it's an important thing to consider. So why is this important to you? Well, like I just said, it's affecting you. If you think 1 in 5, I guess I don't know how many people are on the call right now, but if we say 35, there's probably 7 people on this call. if you're thinking to yourself, I don't think I know anybody with mental health concerns, you do, you're just not aware of it. And so you might want to consider, why is that? You know somebody, it's affecting you. The other thing to consider is if you're an employer and you have employees, your employees are affected by this and they're bringing it to work. It is not, it's not reasonable to think our personal life does not affect our work life. We bring ourselves to work. And that means we also bring our personal life to work. And so things that are happening in our personal life are going to spill in. And so if people are struggling, it's going to come into their work life. It is estimated that $40 billion affects businesses about $40 billion each year due to mental health. So you think about staff who are struggling, they're absent from work, they're not coming in, maybe they quit, they're having accidents, they're not as productive. So these are the pieces as an employer why it's important for you to address these concerns. Also just the overall well-being of your staff. They're gonna be more engaged, they're gonna wanna stay with your company, they're gonna feel like they're valued, and that's really important as well. So as an employer, or even as a friend or a family member, anybody as a person, what are some warning signs? What are some things to look for? And I think you can look at this list and say, well, is it just a bad employee, which is possible. But if you're seeing changes, I think that's the marker, right? If it was an employee who was always on time, always engaged, was high-spirited, really engaged in their work, getting their job done, and suddenly they're showing up late for work. They're not talking to their peers. They're talking about just not feeling well all the time. They're tearful sometimes. Maybe they're more irritable than usual. Those are all warning signs. Now, it doesn't mean they're struggling with a mental health concern. They could be, but there could be some other things going on. But these are things to look for, things to be aware of, that something is going on with that person and you might need to check in. So thinking about what can you do? So again, this is as an employer, what are some things you can encourage your staff to do? Personally, what can you do if you're struggling, or what can you encourage your family member or friend to do if you see them struggling? I think one of the biggest things with mental health is prevention. And again, when we think about mental health, it coincides with your physical health. So if you're physically healthy, you're going to be more mentally healthy. And if you're mentally healthy, you might have better metaphysical health or spiritual health, however you want to phrase that. So those three connect, right? And that is our whole health. We have to have healthy points in all three areas in order to be considered a healthy person. So these are the areas to consider. Exercise. It is really important that we get exercise every day. It releases good hormones and good things into our body that make us feel good. Is really important. Diet. If we eat junk food, we're going to feel like crap. I mean, that's just the end of it. So eating well, getting good exercise is really important. Sleep is super important. I can't emphasize that enough. If you are not getting between 7 to 8 hours of sleep a night, you're not getting enough. For most people, the average person needs 7 to 8 hours of sleep. So if you're running off of 4 to 6 hours every day, you're probably not getting enough. Your body's not getting what it needs to rejuvenate, and you're going to be running on empty, which is going to make you more irritable, which is going to affect what you do and how you think, and on we go. So sleep is really, really important. If you're getting too much sleep, that can also be a problem. So you need to have the right number. Routines, also really important. I know this is really hard right now with COVID and how that has affected our entire world. But even figuring out a way to do that routine in a new way. So for example, if you always went out with your friend on Thursdays for coffee, is there a way you can have coffee over Zoom with your friend, even if it's not in person? I get it's not the same thing, but is there a way to have that routine that's maybe just slightly different? It is sticking with things that we do on a natural basis. When you think about kids, when they look at research, kids who have a routine in their daily schedule do better. They just do better than kids who do not. And so as adults, we're really the same way. We do better when we have routines and when we have a structure in our life. And sometimes we have to just build that in. Tobacco, alcohol use, definitely need to reduce those if you're using it all. The other one that I think people struggle with when I have these conversations is caffeine. Caffeine use can be a huge problem. And so I think just taking an inventory of how much coffee am I drinking per day, or pop or energy drinks, any of those things, and really trying to taper that down. If you're already an anxious person, caffeine mimics anxiety. And so if you're anxious already and you start drinking a lot of caffeine, you're going to start to feel those same effects, and it can actually trigger anxiety responses in people. So I think it's just really important to take a look at that and consider, is my caffeine use affecting my health? If you're also drinking a lot of caffeine and you can't sleep at night, that might be a factor. If you're having racing thoughts, that could be a factor. So just taking a look at that. The other thing, and this is probably my soapbox more than other people's, but energy drinks, they're so bad for you, and they have a lot of really detrimental effects both on your physical health, but your emotional health. Side story, we had a client that came into our urgent care, our mental health urgent care, it's our crisis center here, and she was drinking like 6 to 7 Monster energy drinks a day, and it was making her almost psychotic. Like she was just ill. And when she stopped drinking them, she got better. So again, my soapbox, but I would just encourage you to look at that because it can be a really, really detrimental. The next piece is really being around positive people. We tend to mimic kind of the people we're around. So if we're in a negative space and we're with negative people, we're going to continue to be in that negative space, and it's going to drag us down. If we connect with positive people and we have healthy relationships in our life, we're going to feel better. So it is really about having those people in your life that are healthy, that are positive, that are going to bring you up and build you up and not tear you down. The next thing is about mindfulness. So studies have shown that 5 minutes of mindfulness a day can improve your mood and overall well-being. And if you don't know what mindfulness is, it's really a strategy to be in the present moment. It doesn't have to be, it's not meditation, it's not this major exercise. It can just be as simple as, I'm going to turn off my phone, I'm going to turn off my computer, and I'm going to sit and just look out my window and see what I see for 5 minutes and just be in that moment. I'm not going to let my thoughts flow. I'm just going to be there and think about what I'm seeing, what I'm hearing, and it can be really powerful to just be in that moment. There's a lot of exercises that you can do too, a lot of online things that you can find to practice mindfulness. So I would encourage each of you to just engage in a daily mindfulness practice. It can be really simple. Another thing that is helpful is to find things that you enjoy, hobbies, activities, and making time for them. So again, it goes back to that routine and figuring out a routine and a way to fit them in, because if you're anything like me and most adults in this world, it's, well, I'll get to that later, and then you never do it, and then you're never doing the things that make you feel good and that kind of make you feel whole. So it's important to find what those things are and do them once a week, once a day, whatever it is for you that's going to work, but you have to do them. It's important for us to balance that out so that we're doing things for ourselves, and we have to do that. And then the last thing here is really about that work-home balance. And I think this is really important, especially now when so many people are working from home. It's really easy to just keep working, when the day ends, to just keep going and to bring that work home with us and to not really shut that switch off. It's really important now, especially, to find a way to keep that separation and to find some way to balance it, even if you're working from home. And so some of that might be having a designated space where this is where I work, and when I'm done, that part of me is just shut off and I don't go there until I have to work again. Again, easier said than done, but it takes some practice. So as an employer, and even as a community member, I think part of what we need to do as a community is really reducing stigma, providing education, helping people be more aware of of what mental illness is, providing education to staff members, to supervisors about what to look for, what to be aware of in staff, and then really just being that leader for change, continuing to have those conversations, continuing to provide trainings like this, continuing to have conversations about mental health, about mental wellness, and about mental health, and ensuring people understand that it's an okay topic to discuss. The other piece to that is really engaging with your staff. If you're seeing somebody struggling or you're seeing somebody with some of those warning signs, talking to them. How's your day been? How are things going? And then really listening, really hearing their answers, being non-judgmental towards them, and then trying to offer them some information, some reassurance. I'm not saying you should be a therapist by any means, but sometimes just listening and giving your staff, friends, family that opportunity to just talk is sometimes enough, and that's just what they need. The other piece I think as an employer to consider is your insurance coverage. Does your insurance provide coverage for mental health and substance use disorders? If not, is that something that you would look at doing? Because a lot of staff are not going to go get treatment or get help if it's not covered because they can't afford it. Or if you have a high deductible plan, they're probably not inclined to do it either, even if it's going to be good for them. So I think looking at that is really important. And if that's not an option, would you look at getting EAP services where maybe your staff are able to get so many services related to mental wellness for free? I will pitch, we do have that kind of service here at Woodland Centers. So if you're interested in that, we would be happy to have those conversations with you. So other things you can consider, and I put the caveat at the top, consult with your HR person on this. I am not HR. But there are accommodations that you can provide to people struggling with mental health concerns. So maybe it's they need a more flexible schedule. Maybe it's that they need to reduce their hours for a while. They need to work in a place where there's less distractions so they can be more productive. For people struggling with things like ADHD, they might need just to have one task at a time and not a list. So there might be just things that you can do to offer somebody that are accommodations. But again, think about HR in this one. I am not an HR person, so that's an area for HR to look at too. I think it's also important to consider things not to say or do. I think when we're not sure how to handle something, it's easy to kind of jump back into that mode of, oh, you're fine, it could be worse. I've heard of people having it much worse. It'll be okay. Just get out there and do it and just try harder. It'll be okay. That's really invalidating to people, and they start to feel like you don't understand. So trying not to use those terms would be really important. If you don't know what to say, sometimes it's easy just to repeat back what they're saying so people know you've heard them. Just to repeat it back and help them understand that you're hearing them. I'm not encouraging any of you to be a therapist. If somebody needs professional help, help them get those resources. I think as an employer, knowing what your resources are, who's in your region, who can help with these things, and providing that to your staff is really important. And then try not to go with this alone. If you're a leader of an agency, this should be a change movement for your entire organization. It should be getting other players involved, other people involved that really find this valuable and really want to create this change movement throughout your agency and throughout our community, really. So this is one of my last pieces I'll leave you with. I have some more stuff coming, but this is, I think, a really important thing for all of us to do every day. It's really a wellness exercise. So taking a couple minutes each day and reflecting on these two sentences. The first one, life is 10% what happens to you and 90% of how you react to it. So what this really is saying is that we tend to pay more attention to our reaction to something that happens, less than to the actual event. So since Kim works with me, if Kim walked into my office and rolled her eyes but didn't say anything else, and I reacted with, oh my gosh, Kim's rolling her eyes, she must be mad at me, what's going on with Kim, and ran with that, I'd be reacting to my thoughts, not necessarily what happened. If I ask Kim, she might say, I got something stuck in my eye. Well, so I just made this whole story up that I'm reacting to, where the reality is Kim had something in her eye. She's not even mad at me. That wasn't even about me. So I think this gives us the opportunity to sit back, look at the actual situation, what was said, what was actually done, not how I interpreted it, not how I'm reacting to it, and take a step back. And it's really important because we tend to run with things really, really quickly and make up a lot of stories in our head about what we think is happening versus the reality of what happened. And I think some of these questions on here are really important because maybe I was right. Maybe Kim did roll her eyes. Well, so what? You know, is it really the end of the world if she rolled her eyes? Okay, well, why am I making this a big deal? So I think those questions can really help you to put things into a better perspective. And then the second question on here is really about gratitude and how being grateful about the things in our life can really change our perspective. It's super easy to focus on negativity, to focus on the things that are not going well. You could have 50 things go great in a day and one bad thing. That bad thing is what you're going to focus on. And so this exercise really takes it and says, we're not going to focus on that bad thing. We're going to look at the other 50 and really focus on those. And so it is about allowing yourself time to write down, and that's important, write down the things you're grateful for, the things you feel that have been good for you, things you're happy about in your life or for that day. We did this exercise on our team just about 2020 because 2020 was just a crappy year. You know, we had a lot of things happening with COVID, with businesses, with political unrest, with social unrest. I mean, there was a lot of things that I think we could point to say, what a crappy year. However, there were things that I was very thankful for in 2020. You know, it lent me the opportunity to like slow down. I was able to spend the weekends at home with my husband and my kids. We didn't have a schedule. We didn't have all these obligations to go to. That was really nice. Kind of enjoyed it. As a business, it offered Woodland Centers the opportunity to engage in telehealth in ways we would have never done before. We know what works now. We know what doesn't work as well, but it gave us that opportunity. So I think it's important for us to think about, what are we grateful for? What are we thankful for? Even in really bad circumstances. It gives a different perspective. So here's some information on Woodland Centers. I wanted to offer this to you as well for your resources, for your staff, for yourself. We're on Facebook. If you'd like to join our Facebook page, like us there. We have our website where we offer all of our resources, all the services we offer. If you're interested in getting services, you can go through our webpage and inquire about services there as well. And then we have our mobile crisis team. This is a team that comes out 24/7 and offers services to anybody, anywhere, anytime. It doesn't matter what your struggle is. I think the term crisis sometimes throws people off, but the crisis is really your interpretation. So if you're feeling stressed out, feeling overwhelmed, our team will respond. If you have a child who is refusing to go to school, what happens? We will respond to that too. So, you know, think of it more as, I'm having a mental health concern and I just need some help right now. Our team is there to help you. So call that anytime you need us. Here are also some national resources to consider. And I think these places are really good if you are needing just more information on, how do I talk about mental illness? How do I put up some posters or do more of a campaign? Like the Make It Okay campaign is fantastic for businesses and organizations to just start spreading the message about mental wellness. But these are just some additional resources for folks to consider. And then these are some resources that I like. So the Hilarious World of Depression is a podcast that really takes comedians who struggle with depression, anxiety, eating disorders, but mostly just depression, and kind of puts a spin on it of how they've been able to find humor in struggling through their mental illness, and how they cope, how they get through it, what do they do to help manage that. And so it's been a really interesting podcast to listen to. The next two links are really just mindfulness exercises, but if you Google that, you'll find a whole bunch of those too. So, but again, this will go out to folks. So if you wanted to click on those, you certainly can to find some more resources. The National Alliance on Mental Illness they're all over the nation, but Minnesota has a very strong NAMI affiliation, and they have a ton of resources. So the one I have here in this link is really about managing stress, but they have groups and they have supports for not only people who are struggling with mental illness, but also family members of folks struggling, to offer resources there as well. Learn to Live is an online program for people struggling with anxiety and depression. If you have Blue Cross Blue Shield insurance, this may be covered by your insurance, but it does have a cost to it. So this is one you might want to look at for insurance to see if it's covered, but it's a really good program. And then the Bounce Back Project is actually out of Buffalo, Minnesota, and it offers some resources related to resiliency and gratitude and things like that. And then guided imagery, the last one there, is actually a YouTube video that takes you through a relaxation exercise. So that's the resource list. Again, this will go out to you if you're interested in any of that. You can click on it and see what's there. And this last thing, I think, is just a really great message about why it's important to consider the stigma related to mental illness and why we need to continue the path towards reducing that stigma, increasing awareness, and helping people access services. And that's from Glenn Kjos. I'll give you just a minute to look at that. And this is my contact information. If you want any more information, if you have any questions after today, I'm happy to answer them. If there's information you need for yourself, for your family, for your business, please don't hesitate to reach out to me either by phone. Email tends to be a little bit better, depending on how many we get in a day. But yeah, email tends to be the easiest way, but please don't hesitate to reach out. So that's my whole presentation. What questions do y'all have?
So while people are still thinking, I wanted to throw out just some of the most common questions when I'm out and about in the community or in different groups, of the most common questions, actually. And so I think these will be helpful. I did throw into the notes that there is a texting crisis line that is 741-741, and you can type in Minnesota and there will be people there. And I see a lot of teenagers. This is a really great tool for them. It's a great tool for adults who are like, I don't want to call somebody, but I'm willing to text. We are a texting society. So, and if you would want posters or anything for your businesses, please let us know, because our crisis unit does have those available and we can get them to you. And then the Bounce Back program, there is a Kandiyohi Bounce Back program. So you definitely can find out more information there as well. But one of the things that I've come across is when people find out that I'm the Director of Community Impact at Woodland Centers, I get friends or people out in the community texting me saying, I have a son, I have a brother, I have a sister. And they are, because we're so solitary now and in solitude, is that once you're in your home for a long time, whether it's just working, even with your family, I don't know if anybody else is on this, but about getting back out into society, right? Getting back into actually being in a room with people is going to take some work. But to get people to seek that care, Ashley, and I've come to you with this question before, is people question, well, if I come in and get help, will that go on my record? Will they not be able to have a firearm? So Can you walk us through that? Is if I'm trying to convince or help someone get help with a therapist, what does that mean for me?
Yeah.
On the other side.
There are a lot of misconceptions, I would say, about what happens when somebody starts mental health treatment. When you start treatment, we do a diagnostic assessment. So we look at somebody and we run through a lot of information and we figure out, what is going on with this person? Much like you do when you go to a physician. You go in and you say, I'm struggling with something, and they ask you, well, how, does your throat hurt? Does your ear hurt? We ask those same questions, but just more about your emotional well-being and your physical well-being, about how that's been going. And then we do provide a diagnosis. Often, if we're going to provide ongoing treatment, you will get a diagnosis. Now, what that means is that diagnosis is what we bill services on. It does go to your insurance, but it's not like it follows you anywhere. It's not like, it would then prevent you from accessing other types of care or accessing a gun, or it would go to, your, without permission, we can't release that information anywhere but your insurance. And you actually have to approve for us to provide that to your insurance to bill it. So it is all consent-based. Mental health services is very protected as far as where we can release information and how we release that information. And so even if you have a child who's accessing services, that information will not go to the school. It won't go to their primary care physician. It won't go to anybody until you give us permission, and then you give us specific permission on what information you want them to receive. So yeah, I think there's a lot of misconceptions about, well, if I have that diagnosis, then it's going to affect my life in a really negative way. I look at it as, well, if you get diagnosed with a broken leg, your insurance knows about it because you had treatment for it, but it doesn't impact any other part of your life. It's just getting treatment for a condition, and like anything else.
Great. And Peggy has a question, and it is, what suggestion do you have for an employer to help employees that are in need of professional help but are not seeking the care?
Yeah, I think part of it for folks is feeling like it's okay. So if they're willing to have that conversation with you about, I think I need help, can you offer them the resources to say, whatever region you're in, just to know, like, well, hey, Woodland Centers is here, or Greater Minnesota is here, whatever resources in the area, to provide them a list and say, here are some providers that might be able to help. I think having that warm, caring environment to say, I noticed that you're struggling. Can we talk about it? Are you willing to have that conversation? And I think sometimes just that kind of conversation provides people the ability to go seek help. Sometimes it is about, do I have time off? Am I able to take time away from work to go get the help I need? And I know that creates some issues with businesses and trying to figure that out and navigate it. But I would encourage all of you to figure out how to manage that. So if somebody is needing to take an hour or two off of work to go get the help that they need, working with your staff to figure out how to make that work. I think that can be a barrier as well.
Great. Ken has a question. As we look down the road post-COVID, as a professional, what are you hearing will be the top 2 or 3 concerns or issues? I think isolation is starting to wear people down, and they don't know how to re-engage because they don't know what will be safe. I just hear, I want to see people, be around people, but I can't.
Yeah, I think that's huge. Within our sphere of the mental health world, we've been saying for months, like, we're waiting for this bubble. We know it's coming. We know people are struggling. People are stuck at home. They're not able to see their friends or family. It's kind of just it's a perfect storm to develop a lot of mental health concerns, unfortunately. So we're waiting for, well, we're already seeing increased depression, increased anxiety, and increased substance use. If you're stuck at home and you have nothing else to do, more people are drinking alcohol than probably ever before in their homes. We are seeing a lot more depression in people. We're seeing it in people that never have experienced it ever in their life, and they're now experiencing it because they're isolated and they feel like they can't leave their home and they can't connect with people. And the things we're encouraging people to do is, I know it's not the same, but call people. Get on your phone. Your cell phone actually does work to call people too. So call people, and do a Zoom meeting with your family. It's not the same. You're right. But call them, meet with them, talk to them. It does make a difference, even if you can't physically be with them. There's not concerts right now. People like to go to concerts, but they are doing online concerts. You can sit on your couch and watch a concert. Is that something you'd enjoy doing? So still trying to find some joy, still trying to find some things that bring you pleasure even in a time of crisis. But I would say anxiety, depression, and substance use are going to be continuing to rise as COVID continues.
And so I do have another question here. How do you bring up that conversation up with coworkers or loved ones? And so I'm just going to share a little something here, is that approximately, I don't even know how long ago, but for my own children, when going through a divorce, I asked them or set them up appointments with a therapist. And how I approached it was, this is my gift to you, as you need to know that seeking someone to talk to is part of your wellness.
Mm-hmm.
And the funny thing is that my youngest son, when he was asked by his therapist if he knew why he was there, he said, "It's a gift from my mom, I guess." And she laughed and she looked at me and I said, "It's true."
Yeah.
It is a gift. And I think when we're talking with family, it's a hard subject to approach.
Mm-hmm.
But, and I'll just speak for Woodland Centers, we have tried to make it really easy. And Ashley, I'm going to have you speak to this in a second, is that through our new website, people can put their information in and we will call them to set up their appointment.
Right.
Or they can call, because sometimes to make the phone call is hard. And if you can sit with the person and talk about how this is a wellness piece, and it really does stem from the family. In our community leadership teams, we've talked about how some families, it is about how we don't share our personal business with strangers.
Mm-hmm.
So Ashley, if you want to talk a little bit about that, and if you want to talk about our new same day at Woodland Centers,
Yes. Yeah.
so that we're not
Sure.
making people wait weeks to actually talk to someone.
Yes. Yeah, so well, there's lots to unpack there, Kim. So yeah, I mean, thinking about how do you talk to others, whether it's your family or your friends or your employees, I think it is about, we care about your well-being, and your well-being includes your emotional health, your physical health, and we want to make sure that you're treating, that you're looking at all these components, and are you sure you're okay? Are you sure that you don't need this assistance? And I think it's just great to frame it in that reference of, this is about wellness and about you being the best person you can be. And in order to do that, sometimes we need other people to give us assistance. I say all the time is that I think at some point in all of our lives, we all need to have therapy. It's not just for people that are really, really struggling. It is a common thing that everybody could use at some point in their life. We all have struggle. We all have stress. We all have really terrible things that happen in our life. You don't get through living without experiencing tragedy, unfortunately. And so I think at some point, all of us could use another person to talk to and a professional to give us another perspective. It doesn't have to be lifelong. It just has to maybe be for now, and get what you need out of that. So I think it's about perspective and how much people are willing to hear that. And if that message continues and it's consistent, if it's a consistent message from an employer, from a family member, that person might not hear it that moment, but when they need it, they're going to know, oh, I can go talk to Kim because she's told me this repeatedly, that she's okay with hearing this, even if the rest of my family is not. And they'll know that you're a safe person to come talk to when they're ready. But everybody has to do it in their time. To Woodland Center's point, we are now offering same-day scheduling. So if somebody is needing an assessment, if they're needing to get in for services, they can call that day and we will get them in for services, to start services that day. With mental health, everything starts with what we call a diagnostic assessment. And it's really just an hour-long appointment where we get to know people and try to figure out what they're struggling with and what type of treatment services we can offer them. And so in our previous system, it could take weeks to get somebody in for services. And now we're doing it all same day. So if you're struggling today, we'll get you in today. Because we know life changes, we know circumstances change, and we want to try to help people the minute they need help. The other thing we offer for businesses is we offer mental health checkups. And so for businesses, they can contract with us and any of their staff can have up to 3 visits per year for any reason. They don't need an assessment. They don't need, it's just really coming in and talking. So if you have a staff member who's struggling and they're just feeling stressed out, they can come talk to us and we'll talk to them for an hour up to 3 times a year. No diagnosis, no insurance, nothing needed. Just really contracting with businesses to offer that as an EAP service. So if anybody is interested in hearing more or learning more about that, we'd be happy to have those conversations too.
And then Amber did bring up the Kjos Health has a conversational line. This also came out of the community leadership team here in Kandiyohi. She's put it in the notes. This is really for anybody who's lonely and just wants somebody to talk to. It is a great option. There's no cost. And then if the volunteer on the other end sees there's a greater need, we've trained our crisis staff train those volunteers to know when to pass it on over to us so that we can help if somebody is in need of more help. Mm-hmm. And then Valoris has asked, what ways can we encourage people to get help other than the crisis line when they need to see a person but don't want to due to the cost? That is an awesome question.
Yes, it is. Our crisis services are actually at no cost. So our mobile crisis team is grant-based. So we bill insurance when we're able to, but if the insurance doesn't cover it or if there's a copay or deductible, our grant will cover the fee. So there would be no cost for any person seeking our mobile crisis team. The other thing to know about mobile crisis is that it serves anybody that is in our 7-county region. So, and I say in, meaning they don't have to live here, but if they are traveling through Willmar or traveling through Swift County or Big Stone County, or if you have a family member who's visiting and they're in need of crisis services, they can access that team as well because they are currently in our county and we will provide them that service. So there is no cost to that. Other ways would be having your employer get our EAP contract. I think that's a big piece though, is knowing that our mobile crisis has no charge and that you can access that 24/7. Kim, did you have another thought on that?
Yeah, and I was just going to say, I think what I'm working with people, and Ashley, you do this as well, is we're really calling crisis mental health urgent care. And if we can get everyone on this call to understand that, because crisis just has this negative connotation to it. Mm-hmm. And I've even had people that I've talked to, family members, where I've said, mental health urgent care. It's basically give yourself 1 to 3 days or up to, is it 3 weeks, Ashley? In our mental health urgent care, it's a time for you just to, I almost call it a retreat. But a retreat from life is actually, and when our mobile team goes out, it's not to bring you in, it's to help you there. Yes. And so I think there's just a lot of misnomers and a lot of history that has occurred since we've been around for 60 years, that Woodland Centers has moved in such a different direction over the last 3-ish years, and really in the last 18 months, that any experience somebody's probably had in the last 58 years, Woodland Centers is totally different. And so if people are seeking more information, and then Ashley, do you just want to share about the sliding fee scale?
Yeah, that came to my head too. So Woodland Centers, as a nonprofit, we do offer a sliding fee scale. And so folks just have to come in and show their income and their number of dependents. And often folks have a 0% fee. Depending on their income level, of course, it can be up to 0. And so folks, even if they have insurance, may not have to pay anything for their services, their copay deductible. We have an ability to help cover that through our sliding fee scale. So I'd strongly encourage folks to check that out because it can significantly reduce the cost of people who might be lower income or have a lot of dependents. So,
yeah. And if somebody's questioning the fee, we can always run it first before somebody would seek services, if that is a true concern. We never want costs to be something that keeps somebody from seeking any of our programs or our help here.
Yes. Yeah.
Or somewhere else too.
Mm-hmm.
Any other questions? We do offer support groups as well. I want to throw that out there for essential workers, Spanish speaking, and we also have one for people within the school system. Doesn't have to be a teacher, but anybody in a school system. Those are free of charge. Trying to go through my notes of how do you talk to someone, Ashley? And I think this is where we'll end if nobody else has. I'll come to you, Ken, as soon as I'm done with this question. How do you talk to someone if you mention seeking help and they've had a bad experience in the past, or someone has talked to them about a bad experience in which they're like, oh, I would never do that because of?
I would say give it a try again. I mean, as Kim said, we've made a lot of changes. We're not perfect. Things are not always going to go right every time. But sometimes one experience is one experience, and that was an anomaly. And I would say try it yourself. You know, see how it is for you, because that person's experience might not be your experience. So I think just giving it a try. And maybe we're not the right place, and that's okay. There are other places to seek treatment, to seek help. Whether it's us or somebody else, we just want people to get well. And so if we're not the right place, finding other resources and having that resource list available, so there are options. I think we have a bit of a list created, but oftentimes insurance companies could tell you, here are the providers in your network. You know, if somebody's seeking behavioral health care, mental health care, that can be a great resource. There are some places to find some lists. So if somebody's interested in that, let me know, and I can guide you there too.
And so just want to say thank you again for everyone. I hope you found this information valuable. I will send to Ken and Jamie information about the mental health checkups that we can contract with businesses on for mental health checkups, where your employees can come set it up to 3 times a year here at Woodland Centers. So that's it. That's what we have for you today. And we're 5 minutes done early. How about that? Thank you again.